In this recording, we're going to go over learning activities, sample questions, and discussion questions based on our acid-reducing medications. All right, question number 1. When providing education regarding the use of PPIs, which statement will the nurse include? Pause and try to answer the question to yourself. And that answer is B. Take the medication on an empty stomach 30 to 60 minutes before eating. You will often find that at a hospital, your medication is going to be timed for 7 a.m. When teaching a patient about sucralfate therapy, which of the following statements will the nurse include? This one is D. Sucralfate binds and concentrates epidermal growth factor to promote ulcer healing. So when we look at these, we know that so sucralfate is the one that provides that coating all over your stomach, and it provides a barrier. So number 1 there, answer option number 1, take sucralfate 1 hour before your other medications. We have to take our other meds at least 2 hours before, because sucralfate is going to prevent it, similar to your other acid blocking drugs. Sucralfate is going to prevent those medications from absorbing. And so we want to take our other meds first, wait a couple hours, and then take the sucralfate. Answer option 2. Sucralfate is actually 4 times a day, so they do it. So they typically do it with before meals, and then at bedtime. Okay. Sucralfate acts systemically. No, it is a local action only. It coats and it binds it coats the stomach and then allows everything under it to heal. So there's nothing that goes in and irritates the ulcers. All right, a patient who has chronic renal failure wants to self-treat with an antacid for occasional heartburn. Which medication is the best choice for this patient? All right, this one is C. For our patients with renal compromise, we typically recommend aluminum and sodium-based antacids. And that is because they're more easily excreted. So magnesium-based antacids we don't want to give to our renal patients because they do have trouble excreting magnesium. And then we don't want to deal with a situation of high magnesium levels because that can cause cardiac problems. Calcium-based antacids are harder to excrete in general because they do cause constipation. Now, your renal failure patients are probably already on the low side with their calcium, but we're treating that. And so we don't want to then give them extra calcium and potentially go too high with the calcium. D is incorrect because we can give them the aluminum and then also the sodium-based antacids. All right, when working with an older patient who has been admitted for a possible GI bleed, the nurse identifies which drug is having the potential to cause confusion and disorientation. So which ones did we talk about for these that we need to avoid in our elderly? And that is C, our H2 blockers or H2 antagonists. Simethicone is often combined with calcium carbonate antacids because why? Answer this one to yourself. That one is B. Simethicone helps reduce the gas that is caused by the calcium antacids. Remember that calcium does cause gas, both flatulence and belching. Simethicone is an anti-flatulent, so most of your calcium-containing antacids, like Tums, is going to have simethicone in it to help reduce that effect. All right, so now a couple of questions here. Number 1, why is cimetidine not recommended for older adults? pause your video and think about this for a minute. Okay, so remember that cimetidine so our H2 blockers in general do have the potential to cause confusion in our elderly patients. Cimetidine, though, even more so. It has the most side effects of all of our H2 blockers. It also has more interactions than our other H2 blockers. And so we try to give an alternative. We can start with something like famotidine instead. However, we will often give a PPI rather than an H2 blocker. All right, the second question. A patient is taking a PPI, but there's no history of gastric disorders, including GERD, on his chart. What is a possible rationale for this medication? Think about this for a minute. Remember that PPIs are also given prophylactically to prevent stress ulcers that may develop during illness, trauma, or surgery. And so we do this prophylactically if patients are in the hospital for like a trauma or potentially a hemorrhage of some sort. If they are in the hospital with very low blood pressure, those are the kinds of things, burns, those are the kinds of things that will predispose them to a stress ulcer. Now, do remember that we don't just, we used to prescribe it to every single patient, but we try not to anymore because there is now a predisposition for those patients to develop C. diff. All right, let's do some matching now. Pause and do these to yourself, or do these on your own. And then when you have your answers, come back. All right, here are your answers. The H2 blockers, or A, they're your H2 receptor antagonists. The ones that are H2 receptor antagonists are 1, famotidine, 6, that's the definition, it blocks parietal cells secretion of hydrogen ions and hydrochloric acid. You want to, number 9, give them with caution in geriatric patients, okay? And number 10, our H2 receptor antagonists or H2 blockers do work after a meal. Not as well as if you take them before a meal, but they will work after a meal. B are proton pump inhibitors. That's number 2, pantoprazole. Remember that our H2 blockers are all tidines, and our proton pump inhibitors are all prazoles. Okay, and then number 7, it actually stops the production of hydrogen ions. And number 8, it takes a few weeks to be effective. And then finally, C are antacids. Those are numbers 3, 4, and 5. So those are all our antacid medications. And then also number 10. So number 10 has 2 answers. Work immediately after a meal. All right, so let's teach our patient. Number 1, Dolores is complaining that the calcium carbonate tablet she's taking for antacid therapy taste awful. She says, why do I have to chew them? And can't I just swallow them whole? So what are you going to tell Dolores? All right, you are going to tell her they really need to be chewed thoroughly for the best and fastest effect. So remember that chewing is the first piece of digestion, okay? And so if we go into the stomach whole, then your stomach actually has to break down the whole tablet rather than having just the bits and pieces that can start working immediately. All right, number 2. George is taking a combination product for heartburn. He says, why do these drugs have more than one type of antacid in them? Can't I just take a small dose of milk of mag? All right. So what we're going to tell him, so this is something that, so remember that milk of mag is also a laxative. And so if he takes milk of mag, he is often going to be prone to diarrhea at this point. And so what we usually do, if the patient doesn't also have constipation, we typically use milk of mag as a laxative. Whereas magnesium products that are used as antacids often have something else, such as aluminum, mixed in it. to counteract the effects that cause diarrhea. All right, the third one, John has renal insufficiency and has chronic dyspepsia. So dyspepsia is an older term that you may hear. Just means an upset stomach, heartburn, okay? What antacids should be avoided in this patient and why? So remember that when we have renal problems, we don't give them magnesium products. So your magnesium products are to be avoided in renal problems because they can't excrete them because of their kidneys. All right, Susan. Susan has been diagnosed with peptic ulcer disease, and tests show the presence of H. pylori in the gastric tissue that was obtained through endoscopy. She has prescriptions for omeprazole and an antibiotic. And she says, why do I have to take 2? All right, so what are we going to tell Susan? We're going to tell her that your omeprazole is given to help the healing process. It's for symptom relief. But the antibiotic is being given to kill off the H. pylori. If we don't kill the H. pylori and fix the infection, her ulcers are going to come back, or they're never going to heal in the first place. All right, Ron. He's in for a follow-up visit after receiving a prescription for omeprazole. And he says, my symptoms are the same. When you ask him how he's taken the meds, he says he takes it just after eating and likes to open the capsule because he hates taking pills. So what are we going to tell him? We're going to tell him that he needs to take this on an empty stomach. Okay, best to be 30 to 60 minutes before eating. And also, the capsule should not be chewed or crushed. While he can open up the capsule and sprinkle the granules on, he needs to make sure he doesn't actually chew them, but rather swallows them whole. All right, case study number 1. We have Brian here. Brian is 48 years old. He comes to the clinic today with complaints that the medications he's taking for his recently diagnosed gastritis and small gastric ulcer are not working. In reviewing the medication, the nurse identifies he's taking Maalox, sucralfate, famotidine, and the combination medication of bismuth subsalicylate, so Pepto, tetracycline, and metronidazole. So that's what we call that triple therapy. Brian says, I'm ready to stop taking all of this, and the nurse asks him about his dosing schedule. He says, well, I just take everything at once, 30 minutes before each meal, and then before I go to bed. So what are you going to teach Brian about when to take the Maalox? And then why are there antibiotics? So remember that with the antacid that he's taken, he needs to take it a couple hours after he takes anything else. Otherwise, all those other meds that he's taking are not going to absorb, and so he's not going to have any relief. And then Brian says, why do I have to take antibiotics? And your answer there is that the antibiotics are going to kill off the H. pylori, which is part of the patho of peptic ulcer disease. And so Brian may not be aware that one of the biggest pieces of treating peptic ulcer disease is taking antibiotics for H. pylori. And so he may not be compliant with his meds until he realizes that. All right, case study number 2. Jack is being treated for a Curling's or stress ulcer with a sucralfate slurry. So basically, this is where we either the sucralfate does come in a suspension, and that it comes in tablets and it comes in a suspension. And so a slurry is what you make with it. So the nurse needs to tell Jack how it works, and he or she needs to tell Jack how it's dosed. All right, so how does it work? Remember that it protects the mucosal lining of the stomach in the treatment of active stress ulcers. It's also used in long-term therapy of peptic ulcer disease, because remember that it coats it allows the gastric tissues to heal, and it also stimulates the secretion of prostaglandins. So remember that our prostaglandins in our stomach make that mucus layer up. All right, and what does the nurse tell Jack about dosing? What do you tell him about that? So that's on an empty stomach. It is taken 1 hour before meals and at bedtime. If he has the liquid, he just drinks the liquid. If he has the tablet, then he can mix the tablet in a small amount of water and stir it up, and that helps it helps to dissolve it. And remember that it acts locally, not systemically. And so he needs to make sure that he doesn't take any of the other medications at the same time. So he needs to take all of his other meds about 2 hours before. And that's the end of the learning activities here.